Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute. And one of the most common things I see in the practice is something called plantar fasciitis. And a lot of people get heel pain on the bottom of their heel, and they have this, and they refer to it as heel spur syndrome or heel spurs or plantar fasciitis. And so what this is basically is a condition where the plantar fascia is this cartilaginous fibrous ligament that goes from the heel to the toes, and it gets inflamed as your foot flattens out. Then basically that plantar fascia gets stretched, and that causes tension, which causes inflammation, and that causes pain. And most people have pain when they first get up in the morning, that first step of the day. And then if they've been sitting for a while and they get back up, that causes pain too. And so that's kind of indicative of plantar fasciitis. And the most important thing is getting a diagnosis correct, because other things can be a problem causing the same kind of symptoms, but once we find out that it's plantar fasciitis, then we can address it accordingly. And one of the main things we do for this is to support the foot, and that naturally calms down the inflammation in the area. A lot of times people think that their heel spur is hurting them, but it's not the heel spur that hurts at all. As a matter of fact, you can't even feel the heel spur. And if you do have a heel spur, and we find it on x-ray, we don't ever worry about it. We don't take it out. We don't do anything to it, because that's not what's hurting you. It's actually the inflammation or degeneration in that plantar fascia. And if you take the pressure off that, the pain will go away. So how do you take the pressure off that? Well, one of the ways is a heel cup. And this is a white plastic heel cup. These are very good. They support the plantar fat pad around the heel, and that makes it absorb shock better. And that's really what the problem is. It's not absorbing shock, and all that pressure is going through and hitting your soft tissues. So if you use a heel cup, that really helps. And they have to be a hard white plastic one that supports that fat pad. And then another thing we do is use anti-pain cream, and it's all natural, and it's a roll-on, and that seems to help a lot. And then there's stretching. You have to do stretching of the calf 20, 30 times a day. The more you stretch, the better off that's going to be. And then there's a roller, and you can roll your foot on this special roller that you could put in the freezer, and you take it out of the freezer and roll your foot on it. And then eventually we'll get you, sometimes you'll need an air heel. And this is an air heel, and it has an air pocket here and an air pocket here. And when you walk, the air goes from here back to here, and it massages your foot as you walk. And then at nighttime, you need to sleep in this. And this is a dorsal night splint. And what it does is it goes on the foot, and it holds the foot back. So when you sleep, you're sleeping with your foot up. And that holds the plantar fascia in the right position. So when you stand up, you're not normally when you sleep like this. But we want you to sleep like this. And that stretches the plantar fascia all night long, so when you get up in the morning, you don't have any pain. And then finally, once we can get you these are orthotics, and they're custom made for just your foot. Once you get into custom orthotics, they go on the bottom of your foot inside your shoe, and that supports your foot. And eventually, all you have to do is wear these and good shoes, and then your pain will go away. And all this is natural, and there's no surgery, and there's no shots, usually. Sometimes you need a steroid shot, but sometimes you don't. But all this can be taken care of naturally and safely without any side effects. So that's plantar fasciitis. That's how we treat it, and about 99.9% of our patients get better using a protocol similar to this.